Of age, it is time to really go to school. It's time to get it implemented. And one of the key aspects of it is the Medicaid expansion. But that has to go through the states. And as we've talked about since the program started this morning, the states have been consistently problematic. So let's see if we can answer to Vicki's question. What happens if you live in a state and Bobby Jindal is your governor?
She talked about Texas. What the Medicaid expansion does is, under the Affordable Care Act, anyone up to the 138% of poverty is eligible for Medicaid if the state chooses to expand Medicaid. Over the long run, the state only pays 10% of the cost. The federal government pays 90% of the cost. In the first 3 years, the federal government pays 100% of the cost. Now, the state that has the highest uninsured rate in the country is Texas. So you
it is opting out of Medicaid.
That's right. You would expect Texas to be clamoring to get in to expand the Medicaid, to expand Medicaid. Yeah. But instead, Governor Perry has said, no, we're not going to expand Medicaid. What that means is that ultimately the system will cost more because people will go, instead of getting things taken care of when they're fairly inexpensive, they'll wait until they get serious. They go to the emergency room. It costs everybody more. But ironically, the people in Texas will still be paying taxes to insure people in other states. So it makes no sense whatever.
But it makes political sense if what he's trying to do is to be able to say, you're a poor person living in Texas. Look, Obamacare has done nothing for you, right? Because in fact, he stood in the way of it happening.
But it's not just poor people who want this. And this is why I think even people like Governor Perry ultimately will accept the Medicaid expansion. The hospitals want it. The hospitals need to get paid. And even the chambers of commerce, who are not generally thought of as advocates for the poor. The chambers of commerce want it because it's good for business. So because it's good for hospitals, because hospitals need to get paid, because the chambers of commerce want it, I think even governors like Rick Perry in Texas ultimately will expand Medicaid.
And the linkage to business, aside from the output, but if you want to grow in business, you want to have a healthy workforce. You want to have a population that can be ready to work. You want to go and sell your state to businesses, but if they know you're worst in education, a quarter of your population is uninsured, that's not very attractive to come to your state.
Well, and given what we know about the changing nature of work and the extent to which we underwrite all of these people who pay such low wages, right? Your workers at a Walmart, for example, are, even if they're full-time workers, likely to be eligible for Medicaid, right? This is actually the way to provide health insurance for all of these big companies that pay low wages and don't provide health insurance. But there's a politics not just at the local level, there is still a national politics on this, Congresswoman.
I sit on the Budget Committee, and of course, Chairman Ryan from Wisconsin, is also from Wisconsin, proposes his newest bill to repeal the Affordable Care Act. But of course, he keeps all of the taxes savings from the Affordable Care Act. I mean, you hear about the $710 million that was raided from Medicare. I mean, that was money that was taken from insurance companies. The Medicare Advantage, the advantage inured to insurance companies. Then he cuts an additional $810 million out of Medicaid. So instead of the 16 million uninsured people that we're trying to reach, 16 to 21 million we're trying to reach through the Affordable Care Act, there would be 50 million people who are uninsured.
Wow.
Including, as Michelle Bachmann talks about, those women who would no longer be seen as having pre-existing conditions just by the gender rating.
Just by being a woman.
Just by being a woman.
Yeah.
And so he balances his budget in 10 years by decimating health care. And of course, the voucher for Medicare, there'd be a lot more uninsured people of all ages under Ryan's budget.
Right, and so, Rebecca, we see this. We see the national level politics, we see the state level politics, but on the ground, it is about people's lives.
Absolutely. No, I mean, I think one of the missing pieces of this conversation at a national level is the fact that it's not just about the ACA. I mean, health insurance companies, for example, are starting to provide, in good ways, higher reimbursement rates to doctors' offices that actually restructure themselves to put the patient at the center. So, the story that just stays with me is that there was a patient that we worked with at Children's National Medical Center in D.C. The mom is named Sandra, works 2 jobs to be able to provide for her family, but her son has really severe epilepsy and ADHD. And as the summer approaches, she gets so worried about, what's going to happen to Matthew over the summer when, she's working, he's out of school. Yep. And so she confides in her doctor that this is weighing on her, and he was able to connect her to health leads, and we could get her connected to in-home child care provider so that he would, stay out of the ER. And, that's what it really means for healthcare to be focused on the patient. We should have a healthcare system where patients can talk to their doctors about these issues.
That's almost a magical story, right? The idea of, one from some other kind of decade, it feels like, where you have a doctor,
exactly.
A doctor that has the time to talk to you, who would take follow-up action afterward. And it's not because doctors are bad people, but because the system that we're operating in, the idea of just having a physician in whom you could confide. And if there's some way that ACA, I do want to ask this one last question of you, Congresswoman. Will we, 20 years from now, look back and remember that ACA was the turning point, that this, kind of 3-year-old little bill, if we can manage to not let it die?
If we can manage to not let it die, there's not a penny in Paul Ryan's budget to implement it. And then you have states like my own dear Wisconsin, where the governor, for political, ideological reasons, doesn't want to set up the exchanges. But there was something I wanted to share with you. I went to Russia, broke my finger, went to the hospital, the doctor x-rayed it, said it. I whipped out my Blue Cross Blue Shield card, and they all just kind of looked at me like,
right.
What do we need this for?
Right.
Got back to Washington, D.C., went to Bethesda. They said it perfectly and honestly. This finger is the only thing on my body that doesn't hurt.
I love it. Just this idea that healthcare is a fundamental human right, and that we ought to provide it to everybody, including undocumented folks, visitors, everybody, right? It's a fundamental human right. Maybe this will be the turning point. We will continue to keep our eye on ACA implementation. I also want to say thank you to my panel, Congresswoman Moore with her very well-fixed Russian finger, Rebecca, Jay, and Victoria. Up next, the courtroom bombshell that dropped in the NYPD stop and frisk trial this week.